Welcome to Meet the Docs with your host, Grant Otten, brought to you by Columbus Community Hospital.
Welcome to another edition of Meet the Docs, sponsored by the Columbus Community Hospital. I'm your host, Grant Otten from News Channel Nebraska, and I'm joined by Dr. Eiland today. Dr. Eiland, how are you doing?
Good, thanks for having me.
Well, I guess just to start off, tell me a little bit about what it is you do with endocrinology.
So an endocrinologist treats disorders of the endocrine system, and it's a pretty diverse group of diseases or disorders. And so starting with the pituitary gland, we treat people with pituitary hormone dysfunction based on pituitary tumors, radiation to the pituitary or to the head and neck region. We treat disorders of the thyroid gland, so like hypo or hyperthyroidism and over or underactive thyroid nodules, thyroid cancer. The bulk of what we do, and probably what we're mostly identified with, is diabetes, so type 1 and type 2 diabetes. And then disorders of the adrenal glands, so adrenal nodules, kind of over or under functioning adrenal glands, and also disorders of calcium and osteoporosis. Those are probably the major categories.
Well, you're here in the visiting physician's clinic, and that's got to be cool for you, I guess, being from Columbus, but also talking about the transformation of the building itself. That's got to be pretty cool to be able to work in a nice facility like this.
This is beautiful. This is one of our favorite clinics that we go to. We go to 5 other locations, and it's been really, being from Columbus, it's been really special to be able to come back and treat and see people who I knew growing up.
Well, let's talk a little bit about your educational background and what you kind of went through to get here.
Sure. So I grew up in Columbus. I went to SCOTUS. I graduated from SCOTUS. After that, I went to the University of Notre Dame in Indiana. And after that, I moved to Atlanta for the next 7 years and went to Emory University for medical school, and then did 3 years of my internal medicine residency, also at Emory. And then I convinced my husband to move back to Nebraska, and so I did my fellowship in endocrinology, diabetes, and metabolism at the University of Nebraska Medical Center, and I've been staff for almost 3 years now.
When we talk about being a SCOTUS Shamrock, what's it like being able to come back here and work in your hometown?
It's been so special, though. I've run into a lot of people I knew growing up, both as patients or family members of patients, or people who I just see in the clinic or the hospital when I come here.
Well, why did you decide to get in the field that you did? Was there a decision that you went through thinking about maybe doing something else?
Probably, there are a couple different reasons. I really liked general internal medicine. I liked seeing adults. I kind of liked the broad differential of the primary care. But ultimately, I decided I did want to specialize a little bit more. I like endocrine because you're a specialty, but you still get to follow people long term. Most of the diseases we treat are chronic and lifelong. And so you still get to have a special relationship, a long-term relationship with your patients. I'm a numbers person, and I like kind of the feedback mechanisms of endocrinology, and so much of endocrinology is lab-based, and so I like sort of following those numbers. And I get to see a pretty diverse patient population. I get to see, like a young person with type 1 diabetes and really no other medical problems. I get to see people with pituitary tumors needing multiple hormone replacements, people with type 2 diabetes who have a lot of other comorbidities. It's pretty diverse, and I love that about it.
Well, let's just continue kind of in that vein. What is it that people may need to come see you for if they're experienced, or what's going on with them?
That's a good question. So most of my most of the patients I see come from referrals from their primary care physicians, and that's usually my preference. And so I see a fair amount of people with type 1 diabetes because there's a lot of new technology with pumps and sensors that is sort of always changing. And then, most type 2 diabetes is managed quite well by primary care physicians. I tend to see the more complicated side of type 2 diabetes, maybe complicated by steroids or a transplant or people with high insulin requirements. There's a lot of new drugs out there, and it can be pretty confusing.
Well, and diabetes is something that not everybody even genetically may have it in their family before they get it. Is there some signs, I guess, that maybe they should come get checked out to potentially see if they have diabetes?
Yeah, that's a good point. So signs of uncontrolled diabetes may be like increased thirst, increased urination, unintentional weight loss. Usually primary care doctors do a great job with screening your glucose levels, and ideally we can catch it prior to it getting uncontrolled.
Well, and talk about working with patients over a long term in these different assets that you work with or facets that you work with. What telehealth is something that you're involved with. Can you talk a little bit about that?
Yeah, so the majority of my clinics are telemedicine clinics, and that's what I started doing right after fellowship. So we go to 5 different locations: Columbus, Hastings, Denison, Iowa, Scottsbluff, and Geneva, Nebraska, and Fillmore County. And so usually 2 to 4 times a month I do telemedicine clinics out there. So I'm in my office with 2 screens and a camera, and the patient on the other end is at their local community hospital, and it's sort of like FaceTime or Skype. It's just HIPAA compliant, and it's been going really well. I think it's not for everyone, but certainly more elderly people who don't want to drive in Omaha or can't get a ride, people who live in nursing homes, or people who just can't take a full day or a half day off work even, that want something closer to home. I think it's a really good option.
Very cool. Well, Dr. Eiland, thank you for joining me.
Yeah, thanks for having me.
And thank you guys for tuning in to another edition of Meet the Doc, sponsored by the Columbus Community Hospital. I've been your host, Grant Otten from News Channel Nebraska. We'll see you next time.